Welcome back to another lecture by MedicoMedics. Medical Terminology, Chapter 6, Medical Abbreviations, Acronyms, and Communication. In this lecture, we will have an overview over commonly used abbreviations in medical records, abbreviations for procedures and tests, prescription abbreviations, acronyms, standardization and miscommunication risks, do a practice and application, and end with a summary. So medical abbreviations and acronyms are shorthand methods for documenting and communicating healthcare information. What they do is they save time, but must be used correctly to avoid errors. They are used in patient records, prescriptions, lab reports, and communication between healthcare professionals. Commonly used abbreviations in medical records. So medical records include standardized abbreviations for efficiency. Examples include, for example, BP, blood pressure, HR, heart rate, RR, respiratory rate, DX, diagnosis, RX, prescription. Another one is SX, symptoms, or TX, treatments. Further on, we have abbreviations for procedures and tests. So terms for common procedures include, for example, CBC, complete blood count, MRI, magnetic resonance imaging, CT, computed tomography scan, EKG, electrocardiogram, CXR, chest X-ray. Now, what about abbreviations when prescribing? So common abbreviations in prescription include PO, meaning by mouth or per oral. IV stands for intravenous. BID means twice a day. PRN, as needed. Q4H, every 4 hours. Acronyms for medical conditions. So acronyms describes conditions quickly. So if we say a patient has CHF, we're talking about congestive heart failure. If a patient is diagnosed with COPD, we know it's chronic obstructive pulmonary disease. UTI, a urinary tract infection. DVT, deep vein thrombosis. TBI, traumatic brain injury. And for emergency situations, quick communication is vital. So if we say CPR, we mean cardiopulmonary resuscitation. MI, myocardial infarction. DOA means dead on arrival. LOC, loss of consciousness. ABCD stands for the procedure of controlling airway, breathing, circulation, disability, and exposure. So this is an emergency assessment. Now, standardization and miscommunication risks. What is the importance of standardization? Well, abbreviations can actually differ across regions or institutions. So, for us to speak a common language, let's say, we need to have standardization in place. What are some common errors? Well, misinterpretation due to handwriting or unfamiliar abbreviations can occur. So for best practice, use widely recognized abbreviations. Avoid ambiguous or outdated terms. Write clearly or use electronic systems. Using the wrong abbreviation or unclear writing can cause mistakes. So for example, MS could mean morphine sulfate, but it can also be the diagnosis multiple sclerosis. So let's do some practice here. Decode the following abbreviations and acronyms. If it says BP 120/80, it means the blood pressure is 120/80. If it says PRN, Tylenol, it means take Tylenol as needed. CXR shows CHF, means chest X-ray is showing congestive heart failure. Q6H, IV fluids, means intravenous fluids every 6 hours. And to end with a summary, then, medical abbreviations and acronyms save time but must be used carefully. Standardized use reduces miscommunication. Understanding these terms improves communication and patient safety. And that's the end of Chapter 6. Move now to Chapter 7.